Okay.
Good.
So this is a basic stretching routine that gets the whole body. The most important thing about the stretching is that you hold it for at least a minute. You hold most of these stretches for at least a minute. We want to change the myoneural junction, right? We want to actually change the set point of the muscle, and it usually takes about a minute or more, depending on how tight it is. You generally want to do stretching after you've warmed up, after you've worked out. Okay, you don't want to just jump out of bed and start doing some stretching. You can do more active stretching. You want to, you can do some yoga. You can do, some kind of workout. But even before you go for a workout, studies are clear. You don't want to really do some static stretching until you want to do more jumping and warming up before you go into static stretching. So. But static stretching still has its place in injury prevention, flexibility. One of my favorite studies is that the sit and reach test, right? This test where you put your legs straight out in front of you and you sit and reach. That test, that measurement, actually is a good predictor of heart disease, heart attack and stroke, and overall mortality. So the more stiff you are, right, the greater chance you have of all-cause mortality, but specifically cardiovascular events. So stretching more, this is why stretching is so important, because we don't just stretch the muscles when we're stretching. We're stretching the fascia, we're stretching the arteries, the nerves, and the organs. So it's really important. So one of my favorite stretches is this sit and reach, okay? And I do it a little bit different. As you bend forward and try to touch your toes, also tuck your chin down, and you can get a good stretch here by leaning to one side, okay, for the neck, holding that for 30 seconds, leaning to the other side. So you really want to bend your whole back as you're leaning forward, okay, and then getting that chin tucked down really far. That's what makes this whole stretch, and it opens up the back shu channels for acupuncture channels and meridians. So really helpful for overall body, and it can get the upper traps. Then you can do this lying rotation, and you can use your hand to bring the knee over more and get a good stretch through here. Opposite hand open to get a good pec stretch as well, and hold this stretch for at least a minute, and then do the other side. And back to the sit and reach test, I often hold this stretch for 2 to 5 minutes, because you're getting so many muscle groups, it takes a little bit longer to loosen up. So you do that, and then you can do just like a basic cat stretch, cat and cobra, just kind of back and forth. That opens up the facet joints, okay? So really get a good anterior pelvic tilt, a good dip into your low back, and drop your chest, and look up, and then the opposite. Tuck your chin, tuck your tailbone underneath you, and kind of meet. You're trying to, meet your chin to your pelvic bone. Just really a good stretch, and you hold it for about 3 to 5 seconds. Okay, and you can do this for about 3 to 5 minutes. Okay, you don't have to do it for very long, but it really opens up. And actually, that's a great stretch to do right before bed. Just doing that has been shown to increase the quality of sleep and duration of sleep as well. So we got a lot of the posterior chain. Then we want to do the piriformis. So you sit in a chair that's low enough that your legs are pretty much at a 90-degree angle. You cross one leg. There's many different versions, but I like this version. There's a version where you can do it on your back and you thread the needle. It's a yoga, but this actually gets a deeper stretch, because what you can do with this is you want to do an anterior pelvic tilt. You want to have your low back into a hyperlordosis when you do this. That isolates this muscle. So you don't bend forward like this what you're actually doing is sitting up straight and kind of swan diving forward, right? And keeping your back straight, picturing your chest meeting your knee, okay? And you can modify this if you have knee problems. You can kind of straighten it out if you want, but as long as you're getting the back, okay? And if you can, pushing the knee down as far as you can, okay? So for this kind of figure 4 configuration. So both sides, obviously. That's a great stretch for low back pain, for hip pain, for flexibility. Now, this is just stretching. In addition to stretching, you want to do core, but we'll do core in another session. Then you want to do the anterior chain, okay? So a good pec stretch, okay? So I usually grab a hold of something, and then I turn away, and kind of, if you can grab something versus just a flat surface, you can grab something and lean away from it and turn away from it. So you're getting the upper trap, you're getting the pec, you're getting some of the intercostals, okay? And just holding the stretch for at least a minute. Again, just leaning away from it, opening it up. This is what we forget about, is that a lot of our back and neck pain really come from tight chest muscles. And we don't breathe deep enough, for one, so all the intercostals and chest muscles get tight. And then we're at the computer, our shoulders roll forward, and so our muscles just play tug of war. Our back muscles and our pec muscles just keep playing tug of war. So the tighter this gets, the tighter the back gets, okay? And then we do the quad. Now the key with the quad is to do a posterior pelvic tilt with it, okay? We don't want to just do this, right? It's not really doing much, and it's potentially hurting your low back because it's jamming up the facet joints. So what we want to do is bring your pubic bone in, bring your belly button in, keeping your legs straight down. That isolates all of the hip flexors, including the psoas, okay? This one you might want to hold for about 90 seconds as well. So there's some other stretches that you can do, but if you only had a few minutes a day, these should be done every day, okay? And after your workouts, at the very least, before bed. So just do these stretches as diligently as possible. Obviously, the question arises, how deep do you go into the stretch? You want to feel it. You want to feel the stretch. You want to feel the discomfort. But if you start feeling any kind of pain, then you want to back off and not push it. But you do want to feel that discomfort. So that's pretty straightforward. So, okay, yeah, enjoy.